Sarich joining us here at the desk. We're talking psoriasis. It affects about 1 million Canadians. Big impact on their quality of life. You know, the red, itchy, scaly spots on the skin. For Psoriasis Awareness Month, Leah spoke with a Canadian doctor and Canadian actor.
Yeah.
About his issues and how we can kind of deal with it, right?
This is one of those great stories where you've got an actor who's coming on saying, you know what, I have it too, right? And it's challenging. So that's really nice, especially for Awareness Month. So I want to introduce you to him. His name is Jim Annan. He's a Canadian actor. You might recognize him from Rookie Blues, Saving Hope.
That guy.
Totally, right? You know this guy. He's in a Home Depot ad right now.
Yeah, I think so.
Yeah, Little Mosque on the Prairie, Dan for Mayor. He's been in all of those. He's speaking out for Psoriasis Awareness Month about his battle with the skin condition. So he was first diagnosed at 20, just when he was starting theater school. You know, and this plagued him as his career grew, working for Second City in Toronto, and it really made him very self-conscious. Even with his kids, you can see here, there's a few plaques right there on his chest and on his side there. And you know, it made him very self-conscious, and I spoke to him about how debilitating this skin condition can be.
There were times when I would pull myself from auditions because, yeah, I would have a flare-up, and the audition might call for me to take off my shirt or wear like a tank top and shorts, and I would call my agent saying, I can't do that, and that was horrible. It made me feel horrible. So everyone, when they think of psoriasis, they think of the physical effects, but really the emotional effects can be quite deep and lead to depression.
No question, right?
I bet.
Absolutely. And this is just an example, you know, of how devastating and really isolating the disease can be. You know, you just stay at home. But Jim has his condition under better control now. And by raising awareness, Jim wants people to know how common the disease is, how it's not contagious, how, yes, there is no cure and it's a lifelong genetic condition, but there are so many treatment options now. And you know, no case is the same. Everybody's got a different sort of situation when it comes to this disease. So he wants people to know, really find a dermatologist that works for you and come up with your own specific treatment plan that works for you. I spoke with dermatologist Dr. Andre Medalista, and he says there's so many treatment options now for psoriasis that people simply do not have to live with itchy, scaly skin anymore.
Usually these patients start with some form of a cream, and so there's a variety of creams. Always, often they have a cortisone-based component in them, and so that's usually the first treatment. There's things like light therapy, which is specifically designed for psoriasis, and there's several clinics in Calgary which can offer this treatment. There's more traditional medications, which are usually things like methotrexate. These are pills, but sometimes they have very severe side effects. They can affect your liver. You need to monitor your blood work. And then there's this novel group of medications called biologics, which work very well but are extremely expensive.
And the other exciting thing about psoriasis is that there are always new medications in the works coming down the pike. And in fact, there are several clinical trials underway right here in Calgary that patients can have access to, many of them with this family of medicines called biologics. And so what they're all about is they're about getting much more specific so that they're so instead of shutting down the entire immune system, it's a much more targeted therapy. So that's what they're looking forward to now. So basically, doctors are saying they're looking for a 95 to 100% clearance rate now.
Really?
So a few years ago, they would thought if you could clear it up by about 60%, that would be okay. They're saying, no, we can do better than that. We're talking 95% clearance rate. So if you have this, really see your doctor, get a referral to a dermatologist, and get it done, because you don't have to live this way.
There you go. Good advice.
Yeah, absolutely.
95 to 100%.
Absolutely.